Good evening, and welcome to The Caring View. I hope you're watching us and not the football because it's in Qatar and I can't not remain politically unbiased on the whole bloody thing. So I am glad you are watching us now. We already have a number of viewers. Actually, we've got a comment here. Newcomb here, looking forward to this. Currently multitasking, watching football and waiting for this. Well, I can tell you we hopefully will not disappoint with the guests we've got coming up this evening. Now, usually this part of the show is when we go, we're going to have our social care chat around the news. But we've got someone here joining us today. So before we get started, don't forget to subscribe. Follow us on Facebook, LinkedIn, Twitter, YouTube, TikTok. We never go on it, but, you know, if we get some followers, never know. You never know. And we also have our live podcasts, our recorded podcasts as well. We have a new PIR podcast, which is going to launch tomorrow, hopefully. And that's going to be a series done with Karen Ritson, and it's all about how to complete the PIR, the Provider Information Return for the CQC. And I know I'm usually upbeat and, like, you know, a little bit flamboyant on this. I've developed a bit of a podcast voice. I'm like, hello and welcome to The Caring View. This is Adam and welcome to our podcast. And it's a little bit creepy, actually. It gives me a bit of the ick. But good evening, Mark and Ella. How are you both?
I was literally just thinking that.
What gives you the ick?
Voice. I was thinking, oh my gosh, I'm so unrehearsed for this, and my podcast voice is not on point. Thank you so much for having me.
Good evening.
How are you, Mark?
Yes, not too bad. Thank you very much. Not too bad. Yourself?
No, I'm good. It's a better week. I've got the funeral this week, so once I think the funeral's out the way, I think things will get better. It's a difficult time of grieving, isn't it? That awful interim period. It's like that time between Christmas and New Year where you don't know what to do. You know, Christmas has been, and you've got that awful like week and a bit, and it's like, oh. Then you have New Year, and it's a whole new fresh start. And I believe for me, that's how I approach grief: death, awkward interim, funeral. Let's try and move on and celebrate life and remember everyone. But no, apart from that, I am fantastic. I'm super excited though because Ella is here. So Ella, please introduce yourself to our guests and where you are from.
Amazing. I'm actually I grew up, born and bred just south of Birmingham. I now live in North London. And I work for a lovely company called Lottie. We are a care home and retirement living marketplace, but we also have a free hotline service, and we help people through every step of the process of searching for care. Sometimes people literally just want to have a chat and feel like their questions haven't been answered, or like they need to vent, or that they just need to get a bit of advice. So we kind of help them with that. Or if someone's looking to move into care, or maybe is in the search for a retirement property, we can help them with that a bit more specifically as well. So yes, I work on community and content at Lottie, which basically means that we do a lot of kind of work with our care home partners. And we also always make sure that we're not working on assumptions. So a lot of the content I create and the way that we share stories involves a lot of visits and things like that, and going out and meeting people and chatting with them, asking them questions, getting people really involved. So I do a lot of work with older adults, which I absolutely love. It's really cool. I meet some amazing people, and yeah, we work on some really cool and exciting projects, which I'm really excited to talk more about.
Well, I mean, it's going to be great. I'm hopeful that we will be able to get Lottie on the show for a discussion in the near future around sourcing care and how we can support relatives and people looking for care services in the best way that we possibly can do. But tonight, we've got you here for a very short period of time to discuss a new initiative that launched last week with none other than I'm hoping that's the right show. I don't watch it. Anton de Beck.
It is indeed. I can't tell you how many times that was boomed around the office last week. I even spelt it out at one point and got every single dun 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 in order, which I was quite impressed with. But yes, it was launched by Anton de Beck last week on Carers' Rights Day. It's called Nights on Lottie, and it's essentially a pledge from us to carers all across the UK, paid and unpaid, whether they're caring for a small child all the way through to maybe their parents or their elderly neighbour. But we are pledging 1,000 nights across 2023 for carers to go and have a stay that is paid for and covered by Lottie. We're starting with some gorgeous unplugged cabins that we've kind of pledged the first 100 nights alongside them. These cabins are absolutely beautiful. It's all around the kind of concept of digital detox. So kind of going away, putting your phone away and really switching off, which obviously for people that are in a caregiving position can be really, really, really hard to find that time to yourself. And they've had so much feedback about kind of the transformative nature of their stays that we thought they would be a really, really kind of wonderful first partnership to kick off our 1,000 Nights of 2023.
Absolutely incredible, and there's so many people out there deserving of a stay and a breakaway. You know, my granddad for one, and I might try and get him nominated on this. His last 5 years he's looked after Nana, and now she's no longer here. It's like you can look after yourself now. Go and relax and chill out somewhere. You know, go and chillax. How do we get people involved in this? How do we nominate? Do we nominate? Is it what's the process?
So we've set up a landing page specifically for this that's got loads of information on it. It could be nominating and how to do that, or it could be if you need some practical advice about finances or a bit more on the pastoral side, you need a bit of advice, you can find it all on there. It's lottie.org/NOL for Nights on Lottie. So yeah, lottie.org/NOL, and you can nominate yourself or someone else. So we're kind of taking both nominations. It's a couple of fields, really. Just pop your name in, a little bit about either yourself or the person that you're nominating. You send it off, and then we'll essentially randomly select the winners. And the winners will be announced on the 16th of January, which is Blue Monday.
Wow. So we don't have long really to get people nominated, do we? It's just sort of let's get this sorted and get. So how many places are there to give away?
So in our first round of giveaways, we've got 100 nights, which will equate to 33 winners. But that is the first, obviously, of an absolute massive group of giveaways we're going to be kind of rolling throughout the year. And the really cool thing is, since we kind of launched and we had some really nice press, because thankfully Anton was involved, we kind of pitched it out. We've had loads of people get in touch and offer their hotels, offer their transport services, offer to sponsor it. Which is really, really, really cool and really nice to see, and amazing considering our Nights on Lottie was actually inspired by a similar initiative called Nights on Us that was set up in the pandemic by these incredible volunteers that did a really similar thing, but for people that work for the NHS and a lot of ICU workers as well. And that's kind of where we got the inspiration and wanted to do a similar offer, but for people that work in social care.
I think it's a really great initiative to recognise both people working in social care, but also unpaid carers. And you've got people covered, haven't you, for different locations across the UK. You able to let us know about any of those locations for anybody watching?
Yeah, absolutely. So at the moment, Unplugged cabins are located near Manchester and London. We want to, throughout the year, do loads and loads and loads of different locations, but we've kind of chatted with the team about it a lot and said that if people are struggling with transport costs, to just reach out to us. We're happy to help out, because we would hate to open this up and then get someone, you know, coming on a holiday and then they realise, you know, if it's that time of the year when things are very expensive coming up to Christmas, or you just can't afford it, the cost of living at the moment is astronomical. So we really want this to be a restful experience and not something that's going to add even more stress. So if anyone, needs a bit of help with transport, I'm happy to book some trains. Or I did say to Will, can we maybe go and pick people up in a pink limo? But we're working on that one.
A pink fluffy limo, I'd imagine.
A fluffy trip.
And I was just looking at the website. The nomination form is really simple. It's literally, are you nominating yourself? Yes, no. Your name, phone number, email, what type of carer are you or the person you nominated, the role in care, and then just the reasons for the nomination. So really simple, really quick, and urge anybody to get on and show somebody actually that you're thinking about them, recognizing them. And like Ella said earlier, you know, actually unpaid carers have a really tough time at the moment. Care workers have had a tough time over the last few years. So actually let's reach out and show people that actually we are thinking of them. I think it's a great initiative. So well done to Lottie.
Thank you so much. Yeah, and we just, anybody that feels like they want to nominate themselves, particularly people that want to nominate themselves, I think, because like my mum is a carer and I know that she is the most bashful person who's so modest about all that she does. She's an unpaid carer. And I just think that in those circumstances, if you don't have someone that you're thinking, oh, they might not nominate me, or you think, God, you know what, I am tired and I need a break, please do nominate yourself. Please do. I would absolutely love that, because there's so many people that have to constantly put everyone else first, and just having that small moment to yourself, I think, can be so amazing and transformative.
And a great way to kick off 2023.
Yeah, exactly.
Well, honestly, thank you so much for joining us tonight, Ella. It's been great to, see this. I mean, I was trying to tease out of you over the last sort of weeks, like, who's it going to be? What's the name? Come on, give me clues. I would never have guessed Anton Dubek. I would never have got it. You were correct. I think it's a fantastic initiative, like Mark says, and we will try and get this shared all over our social medias. We'll get it on our website, and we'll share it through our networks as well, see if we can get more people to nominate themselves and nominate others. If you're not going to be able to recognize yourself, don't hang around for anyone else to do it. Let's start recognizing the amazing time we give up for everyone else. So fantastic initiative. Thank you so much.
Amazing. Thank you so much for having me. And let me tell you, keeping Anton Dubek a secret from my grandma, who is one of his #1 fans, was awful. And then I literally had to wait for about, I'd say, 24 hours before, and she told half our town, and I was like, oh my gosh. An embargo. I kept saying that word, and I was looking at her, she was looking at me, and I was like, I don't know what it means either. But yes, please sign up, and thank you so much for having me and letting me chat about it.
You're most welcome. Thank you so much. We will see you soon and catch up. Take care.
See you later. Bye.
Oh, I might nominate me, Mark. No, I'm joking. I am joking. I could do the week away. I think there's plenty of people that we know that could probably be nominated, relative-wise, friend-wise, worker-wise. So, yeah, great initiative. Let's get nominating. So, to tonight's conversation, Mark, what are we talking about?
We are talking about integrated care systems, and we are very lucky to be joined tonight by two people from the NHS transformation team. So we have got Caroline Day and Emma Harris. Good evening, both of you. How are you?
Very well. And yourselves?
Not too bad, thank you. Not too bad.
I feel Caroline wins on the festive stake this evening. She is fully imbibing in Christmas already.
You've got to go early with Christmas, guys. Spread the cheer, spread the warm glow, spread the happiness.
If my house wasn't such a mess, I would trail my laptop through just so you could see the festive bomb that has hit my home as well. I'm with Caroline on this. I am for Christmas, all the time, as early as possible. As early as possible.
You're missing the tinsel on the ivy behind you, then.
Oh, I don't have tinsel, I'm afraid. I'm not a tinsel person. I almost went back to tinsel this year. I like a bit of kitsch, and I've got kitsch on my tree. I like those sort of vintage decks, but I've also got cats, and I don't want to be pulling it out of orifices where tinsel should not be found. So no, tinsel does not exist in my household, I'm afraid. Anyway,
so Caroline, Emma, did you want to introduce yourselves, let everybody know what you do at NHS Transformation? Who wants to go first?
I'm going to take the lead. So my name is Emma Harris. I am the Assistant Director for the Digitising Social Care Programme. So we are a team of policy and programme people that have been brought together to help support the adult social care sector from the expectations that were placed and written about in the Putting People at the Heart of Care white paper. I've got a team of amazing humans, one who is with me this evening, and all of us have got some level of background in social care, whether that's relatives that are currently receiving social care, and Caroline will go into her amazing stories in a minute, or those of us that have worked in social care. So I started in learning disability. That's where I was working, and then moved to mental health and supporting kind of that connected healthcare approach, and now have very luckily been able to move back into social care again. And Caroline?
I don't know how I beat that. So I work for Emma as part of the Transformation Directorate team. So I am a programme manager delivering digitisation across social care. I am a regional lead. So I work with the 6 integrated care systems across the east of England. So speak with them on a weekly basis to help them shape their plans for social care for the next 3 years. As Emma said, we've all got a story to tell or a background or some history. I've spent 10 years working in primary care, so running urgent care centres, GP practices and walk-in centres. And during COVID, my grandmother, who was living independently, fell at home, broke a hip, ended up in hospital during COVID, was discharged, came home, receiving care visits 4 times a day. In between visits, fell and broke her other hip, ended up back in hospital where the journey started again. And as a family, we said this has to be better. There has to be a better way of doing this and of supporting people as they move from living independently through to being a receiver of adult social care services. She is an amazing person. She is super happy. She is in a care home and they are the most incredible team. That team have gone on a digital journey and they now have a digital social care record and they have other technology in there. So I am a huge advocate of how technology can support people to live their best life independently, regardless of whether that's in a residential setting or whether that's living independently at home. But it's great for me because I now get a chance to try and prevent the journey that my grandmother went through from happening again by working with ICSs to bring these type of stories to life, so that we're not just ticking boxes, we're not just, you know, investing money in services to try and pilot things without really getting the value out, really getting the learning out, and then scaling up and implementing what does work well. So that's me in a not so small nutshell.
I think what's really reassuring here, especially for myself and most probably Mark and other social care listeners, is we're talking here about NHS integration, we're talking about NHS ICBs, but we're actually talking social care, which is completely different. We're not used to these conversations. Now, we had primary care trusts. They went in 2013 and we got CCGs. CCGs have now gone and we now have ICBs. What are ICBs, ICSs? Is it just another name change, or are we going to see some like real change? Or in 7 years' time, 10 years' time, are we going to be replacing them as well? So, what is an ICS? Purpose? Where did they come from?
Okay, so I'll pick up the lead and kind of give a small potted history. I'm also going to absolutely not claim to have written all of this information, and if you are looking for really good guides out there, go and have a look at the King's Fund, people. They have been paid lots of money to develop really, really amazing resources that will talk you through anything that you're looking at. So I'm going to poach with pride because that's what I do, and kind of give you a bit of a potted history as to how they've come. So they were set up to kind of sit within that triple aim of NHS bodies, where we're looking at health and well-being, we're looking at quality of service, and we're making sure that we've got that effective use of resources of within the bodies that live underneath it. They developed from what was known as an STP, so a Sustainability and Transformation Partnership, and have now come into being an ICS, which is an integrated care system, or you may hear people call about an ICB, which is the board that lives within that makes the kind of legislative decisions underneath it. Or you may also hear about something else that's called an ICP, because we're the NHS and we love an acronym. But all of those things, they're only aimed that they should be delivering for you as a human, because let's face it, everybody lives in one, is that they should be looking at the outcomes for the people that live within it. They should be talking about the inequalities of those outcomes. They should be enhancing how they're working, and they should be helping to help support the NHS to be able to deliver better care with their social care partners within that locality. There are 42 of them. You should be able to go and have a look and figure out where you are. It's a pretty good search. There's some pretty good searches that you can go and have a look at that will tell you where you live. Personally, I'm down in the southeast. I am in the Sussex Health and Care Partnership. So that covers Sussex, West Sussex, East Sussex. So they're not really county-led. They're more collection of local authorities and CCGs, PCNs that kind of have come together to help support the best of their endeavours within them.
Good answer. So detailed. I have shared the King's Fund link, and I've also shared a link from the NCF, the National Care Forum, which is how you find your local ICS and the partners and people involved. And I think we need to reassure people that actually you do need to go away and you do need to do some homework in your local area, because I live in Essex and there's 3 different ICSs that cover just Essex. And obviously, Caroline, you cover obviously the region. So I'm sure you can tell us more about kind of how people get involved, why care managers and social care providers and, you know, directors, CEOs, why it's important that all of them are kind of involved and aware of their local ICS.
Yeah, so absolutely. So first of all, back to your point around Essex and 3 ICSs, I think it's really important to realise that local authorities and council boundaries aren't always coterminous with kind of the boundaries of integrated care systems. So it's not as easy as kind of drawing a ring around a geographical area and saying everybody in that patch fits neatly into a box and the neighbouring patch, they all fit neatly into a box. Sometimes the local authorities, so the councils, can cross boundaries and borders. So it does have its complexities and it's not always straightforward, which is why that National Care Forum tool that you've shared a link to, Mark, is fab, because you can search and start to understand more of the organisations that fit within the area that you live in or that you deliver services in. In terms of why would you as a care provider want to know who your ICS is and who is part of your ICS? Well, first of all, there are great things happening within integrated care systems. So there is funding being made available. They are creating tools and resources for care providers, social care providers, not health providers, social care providers. And second of all, we should all have a voice. You know, we should all, regardless of what type of health or care services we are delivering, we need a channel through which we can share our feedback to help influence the decisions that are being made by integrated care systems. So they are, as Emma said, partnership organisations that have come together to help develop the strategy of health and care services for that area. So that means they are deciding what the future looks like. So they can't do that without hearing and listening to what is happening on the ground in reality across health and social care. So on the digital social care website, for example, if you have a look at funding opportunities on the digital social care website, there is contact details for each of the integrated care systems who are working with us as part of our digital transformation programme. And if you want to get involved, if you want to understand the funding that's available or the support that's available to digitise social care, there is an email address with a human being sat behind it, and you can send that email address an email and someone will get in touch. Local authorities, so your council representatives, are also a great way to get involved with the integrated care system. So if you've got feedback, things aren't working, you've got ideas or suggestions for how things could be changed, then again, care providers could use their local authority, their council as a way of doing that. But lots of ICSs are already starting to recognise that listening to what's happening on the ground is really important as they start to develop a digital strategy for the next few years. So they're already starting to hold engagement sessions or listening forums. So it's really difficult to say how everyone can get involved because there are potentially 42 different ways of doing it. But have a look on the digital social care website, first of all, to have a look at what's happening, and then reach out, speak to your local authority representatives, and they'll tell you what's happening within social care, within your integrated care system.
Wow, incredibly helpful, and thank you so much for that, Caroline. And I suppose maybe there's a sort of answer in there for this, but we've had a comment come through in the chat, and forgive me, I'm terrible at acronyms, so I'm presuming BSOL is Birmingham and Solihull, but correct me if I'm wrong. And I'm also terrible at geography. I used to think Torquay was in Japan, so I'm one of those people where do not trust me on anything like this. But is there any data yet about how many are up and running already? Which of the ICB's direct social care representations? Because BSOL, Birmingham Solihull, is not yet communicating.
So there's a vague answer because I live in the centre, and so I'm going to give you a slightly fluffy answer around some of it, because the honesty is every ICS in the entire country is engaging with us. Every ICS is working with us, And every ICS are on the journey to be able to understand how best to support their care sector within it. Within BSOL, I believe there is now a page that is up and running that you can go and have a look at. So you should be able to see those elements. And Caroline's now looking for me. She's looked off to the side. She's like, I'm just going to check. But you should be able to find a human that will be able to help support you. The other thing that I have is a regional lead that lives across the BSOL area. So we are very happy to share our contact details as part of this. And we've got a direct mailbox that comes directly into the team that you can drop us a line and ask a question and say, I'm experiencing a challenge. Can you help us? You'll see in there that there's a website that's just been put on the link. And we know that Birmingham and Solihull are developing their plans. We have had a 1-year plan from everybody. In that 1-year plan, they are working through the delivery elements of it. And so there will be humans, if there are not humans in already, that will be there and ready to support you. But they certainly have already got a plan and an approach to help with that.
Thank you very much. Now, we know that we've spoken to some care providers, some managers, and there does seem to be a barrier for some providers sitting on kind of local steering groups and getting involved. And I know I oversee 2 different contracts for my day job that are both over 2 different localities. Now, I was really lucky that I knew one of your colleagues, and then I reached out to Caroline, who very kindly helped me direct me through the murky waters. But not all care providers are going to have that. Well, they might now because they can reach out to you after. But for anybody struggling to kind of get a place at the table, to kind of get a response, what would your advice be?
So I'm going to start and I'll let Emma come in and add in anything. So I would say go through your care provider associations, because they are great advocates of making sure that social care has a voice, and all of the local authorities as part of the integrated care system are actively reaching out now and trying to strengthen those relationships. I think it's really important what Emma was saying about each ICS, starting to get up and running, but they are at different levels of what we would class as maturity. So some ICSs were running in shadow form for a good year before the July legislation came in. Others are fairly new in terms of their relationships. And so those links with social care and those links with provider organisations are yet to be developed in some ICSs. So I would say go through your care provider associations, reach out to your local authority, and also have a look on the National Care Forum websites as well. Emma will pick up anything that I've not covered.
No, and I think that probably does cover it. We are aware that there are a lot of health and well-being boards that already exist within your local authorities. Those local authority boards are also feeding up to their ICSs. So that could be another route for you to be able to kind of get involved with what's going on within the local authority. That local authority goes up. We are trying to provide the best interactions that we possibly can. But we are one team that are helping to support 42 areas. And this is the first time that I think probably any of you would stand there and say that person over there with the NHS email address is actually here communicating, working collaboratively, doing as much as we humanly can to help support and give that voice at the centre for social care, which we know there's been a lot of initiatives, and we know that COVID taught us a lot about the value and investment and how to be able to support it and where we needed to be able to move forward. But we are now trying to take that next step further by having more integration, by engaging with the care sector, by making sure that if there isn't even a seat at the table, that we know where the table is, we'll at least try and point you in the direction of where the table might be located.
And I think, great answers. And then we've just had another comment come through saying that they've tried and they've had no response from people who they've been communicating with. I think Mark and I are confident in saying if, you are watching this tonight or on catch up and you are struggling to get in touch with people, get in touch with Mark and I. We can try and network you with the people that you need to be speaking to. We can have conversations and we can help build those bridges, because I think for the first time in a very long time, social care is working together. And, people aren't shy about saying, actually, I'll jump in and help, and I'll connect you with people. And we're not shy about doing that now. So if you are struggling, do contact us after the show. What's our email, Mark? thecaringview@gmail.com. Or find us on one of our social medias, and we can help connect you with people. Maybe even Emma and Caroline. You never know. You never know. Emma's going, no.
No, I'm not actually at all. I'm not going to say I'm the best at making sure I'm always as responsive as I should be, but I'm not sat here in a golden tower going, don't talk to me. I'm here saying, please do get in contact. We will find a way to help support you. That does put me in a challenge of, like, all of a sudden the 5 million people that work in the social care go, oh, look, she can help. But we are out there and we are doing the best that we can. Sally, I would be interested to find out if your question is on hospital discharges as opposed to being able to get in contact with other people. So I'm sure they will make a way of being able for you to kind of help get in contact. We should be able to help support you if we can do.
Thank you very much, Emma. And I think it's worth noting, I know I had support from kind of both of you and your colleagues, and should also utilise doing, and obviously we said it earlier about doing your research, but find out who's on the board, find out who makes some of these partnership groups, and actually reach out to them. You know, the emails are normally, you know, available on Google, or reach out to them on LinkedIn, or I use Twitter, and just, you know, actually reach out and explain who you are. And I know when, for Havering, for example, I knew social care wasn't kind of on their agenda at the time, and I just kind of went out to every director I could find, anybody on it, and was like, it doesn't have to be me, but actually I really am keen to get social care on that agenda, however that looks, whether that's me, whether it's Havering Care Association. What can we do to make that possible, and kind of put that ball in their field? And so,
and
yeah,
you know what,
thing
Mark?
about being
Sorry, Adam. I was just going to say, do you know what? We are trying as well as the centre to get out and to visit care providers and to spend time physically, now we can, with the integrated care system teams to have real conversations. And the integrated care systems, or the boards, the people that sit on the boards, they're equally as keen to get out and spend time with care providers. So, you know, it was great for us to have the opportunity to go and see Mark and his teams last week, to speak to trusted assessors, to go and visit centres, and to ask real questions around barriers, blockers, what's working, what isn't working. And that feedback comes back to us, back to NHS England. But again, the integrated care systems are keen to get an understanding of what the reality looks like on the ground for care providers. So as Mark said, reach out to them, get in touch, offer them the opportunity to come out and spend the day. I think it's interesting how many care providers don't make that offer, and whether that's because they think we're big and scary, or we don't want to go, or we don't want to visit. But actually, it's definitely the opposite.
We definitely do. We really do. And actually, the whole senior team are wanting to go and do these visits. We want to come out and see the realities of it, because I'm not a care provider. I've worked in care. I understand the challenges from my own reflection of it, but I've not been there sat on a Sunday going, I've got no staff next week, what am I going to do? And then we're turning up and going, have you thought digital? Because we'd really like to help, but that's probably not the most priority thing that you're trying to deal with at that particular time. But we are wanting to have that communication, and we are absolutely based across the entire country, and we will come and visit.
And I would just say there's something about being a bit brash, you know, and being a bit confident about this. So, you know, I'm from Lancashire. We don't have a care association, sadly, in Lancashire. We used to. That's another story for another time, and probably a bottle of wine, because it's quite a good one. But we don't have a care association anymore. So there isn't that independent voice there for providers. What we do have, though, is a regulated workforce group that is keen to engage with providers. And we're going, well, that's great. Get us on board. How can we have these conversations? Because I'm going to be there, and I'm going to be having these conversations, and we're seeing more providers now come through to be able to having that seat at the table, to the point where we're actually looking at, I mean, I will say, alongside the IHSCM, it's something I'm creating, a voice for people that can be independent from local authority and health, so that providers can have that voice without fear of bias or sort of blowback on them. So just be bold about it, and be confident, and ask people, and it shows that actually you care, and you know they'll have confidence in you, and it's brownie points for CQC. So you know, why not? So the Digital Transformation Fund is available. Can you tell us more about this and how providers can access it?
Yep, absolutely. So, as I mentioned earlier, in the People at the Heart of Care, there was a line in there that talked about £150 million that was going to be rolled out to help digitise the social care sector. From that, we have taken that, and in there were the targets of, by 2024, 80% of adult social care CQC registered providers will have adopted a digital social care record. So DSCR, you'll see that's an acronym that's out there and floating around. So that is what is known as a digital care plan for anybody that's going, what is a DSCR? We also set in there that we would want those at risk of a fall would be supported by some type of sensor-based falls detection technology, and that we would look at other types of care tech. Alongside that, there was also information in there about supporting a fund that would help keep people in their homes for longer by supporting activities of daily living. So we've got a few different elements that people can get involved in and help be supported in. So are you looking to put in a digital social care record? Do you know where to start? We've put in there the really good links that would start taking you on that journey. Do you know what to buy? Do you know where you want to go? Do you know what type of products you want to be looking at? So we've developed this subset of the digital social care website that should take you on that journey. Within that, you'll find things like the assured supplier list. And that list is a group of suppliers that have been through our assurance process. Now, that means that they can be funded by us. So we are looking at those particular providers, and we are looking to fund those care sectors to have those products. Now, the reason behind that is we have learned from our colleagues over in the NHS, and I'm going to say we have learned from over in, because I'm going to put myself in the social care bucket at this point. But we know that being stuck in a contract you can't get out of is not fun. We know that having your data stuck in a product that you can't get it back out of is not fun. So we're trying to make sure that the products that we're putting forward have been through a level of assurance so that you know, as a care provider, they're going to be interoperable. You're going to be able to share information with your partners. You're going to know that they have got stringent funding streams behind them and that they're not going to fold in the next instant. So we have made sure that those products are able to be assured through a rigorous process that we put them through. If there are also any missing that you're like, oh God, I really want to buy this one, but it's not there, what's going to happen? Send them our way. That list is always open, and very, very specifically so that if there are new products emerging on the market, they are not being negatively impacted by not being able to be on that list. So that's the assured suppliers and the funding. I'll let Caroline cover off how to be able to get involved and what's going on.
So the good news is there is funding available for some of this. So upfront and honest, we are not covering the whole cost of your digital social care record or your falls prevention technology forever and a day, but there is 50% off year one costs available. Now, going back to the earlier conversation we had about 42 ICSs, all at slightly different levels of maturity and engagement, it means there are 42 slightly different ways of doing this. The good thing is, though, because the money has gone to the integrated care systems, they're reaching out to care providers and working with their local authorities to understand the best way of getting that money, plus tools and support and resources to care providers. So the ICS who have signed and delivered their delivery plan and have a clear plan for this year, on the digital social care website, and I think we've already put the link in the chat, so thank you for sharing that. If you go onto the digital social care website, you can find your region, the integrated care system that you sit within, and that page will give you an overview of how that integrated care system is working with care providers to get the funding out. The good news is that of the 42 integrated care systems, 32 of them are already at the stage where they've got expressions of interest and application forms that you can fill in. So if you are a care provider and you're thinking, I want some of that money, then that's great. You can fill in a form and you can start working with your local authority or with your local team to start expressing an interest. The great news, even better than the money, in my opinion, is that there is help out there to help you on that journey. So digitization can be scary. It can be an anxious place. It can be, if it's not something that you've mapped out, that you've got a plan for, that's even been on your radar, it can be something that feels a little bit off-putting. So there are teams available within the integrated care systems to help providers on that journey. And that might be things like getting yourself cyber secure and making sure that your data security and protection toolkit is completed and that you're ready to start that digital journey. It might be, God, we've got 20 residents. How are we going to input all their electronic care plans? How much time is it going to take us to do that? Where do we even start? So the teams are creating lots of tools and resources to help you start to think and shape a plan for that. So, yeah, top line, go to the digital social care website. If your ICS isn't on there or there's some information missing, use us and we're happy to help signpost.
And I'm just going to put it out there. I love completing the DSPT. Mark knows how much I love audits and things like that. DSPT, oh, I love it. So if anyone is struggling, and independent consultant here, if you want to utilize me to come and complete your DSPT, I will gladly come and do it and educate you on why it's so important and support you with implementing the resources along the way. I just have one quick thing on digital social care records, and I won't use the acronym because I'm trying to be one of those people who tries not to use acronyms, so I'm inclusive for everyone. It's something I've mentioned to the NHS in our local ICV, especially if we're going to be getting citizens on board, because my brain just goes poof with acronyms. But with digital social care records, there's one thing around compliance in getting people up to that sort of percentage by 2024, but there's another thing about competence as well, isn't there, and making sure that actually going on to digital care records doesn't lose the holistic, person-led, person-centered approach that may be in the individualized and sometimes innovative paper records as well. So what is digital social care and what's your team doing to make sure that actually we're not going to lose that quality along the way?
So I think a lot of that is going to be very locally led, but we do know that some of the products have got the real ability to have this innovative side of things. I'll let Caroline talk about her grandma in a minute and the digital social care record that's happened to be implemented over there. But there is the ability. What we believe is that by implementing a digital record, it gives more time to care, less time filling in paperwork and trying to remember what Gladys had at 9 o'clock this morning for a drink. And that interactive and intuitive way of delivering care becomes more centered around the human, because you're not having to write abridged versions of something because you're now trying to remember however many residents you had to support, because everybody needs your time and it's so important that they get it. But that information is more gathered in that holistic view at the point of care, which makes it a better interaction. And we also know that we've got great stories like Caroline's grandma, who we regular reference. And Caroline's grandma is our little team, one of the adopted team grandmas as it stands at the moment. And Caroline is very bashful because she actually volunteers now in the care home that her grandma is in order to be able to do more for that care home and help support further.
So also, I just want to reference, so they are a great care home. They're a lovely team. And yes, digital social care records, there is a risk that some people might think it would be seen as a tick box exercise. Has this happened? Tick, 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 done. Actually, in reality, the care providers that I see are inputting much more information into a digital social care record than they ever would on paper, because of how easy it is and how much quicker it is to be able to input information in there. And although recognizing that not every individual in receipt of adult social care is my grandma, and we're not all, we need to absolutely reflect that it's a heavy stereotype, isn't it, when we labor actually it's older people. Adult social care covers a huge spectrum of individuals. So although we focus on, the elderly populations that tend to be in care homes, it's important to recognise that the Digital Transformation Fund is open to any CQC registered adult social care provider. So that could be learning disabilities. It could be supporting people in their own homes as well. But my grandma is the biggest advocate of the digital social care record. When someone comes into her room with an iPad, she's going, have you written that down? Can you add this in, please? Can I use that to book my activities for this week? So I think it's about as much about changing the individual who's in receipt of care, changing their perspective on electronic care records, as well as it is taking the workforce on a journey. And while we're on that kind of digital skills and digital literacy journey, Adam, I think it's really important to note that our team are recognising that there is a skills gap that we need to help and support. So we have a small team who are completely dedicated to helping to map out where those skills gaps are and creating resources, e-learning sessions, training material to help almost plug that gap really and help people see that it's not scary. It's, you know, it might feel scary at the beginning, but all the resources are out there to help you embrace those new digital skills. And reflecting back during COVID, you know, as care providers and as NHS kind of health providers as well, massive steps were taken in digital skills and digital literacy. So, you know, we moved mountains during COVID to develop skills so that we could embrace new technology. And I, for one, really want to build on that and keep that momentum going, because there is a risk that we regress slightly and take our foot off the gas. But I think it's important that we reflect what didn't work in COVID, what we could have done better had time, you know, been given to us, but it wasn't. And now what can we do to build on just how much progress we made during COVID and now as we move forward into the future?
And just to follow that up, Mark's very kindly just thrown in the chat the digital skills framework, training and resources that we have been developing. It is in draft. There is your opportunity to be able to give your feedback, and the team are ready and waiting for you to feedback on it. We have very, very specifically kind of developed those digital skills resources because, you know what? It can be really scary. You know, if someone isn't used to being able to live their life through one of these and they're all of a sudden being told that that's the way they need to do things, it's downright terrifying, because I'd be like, well, it's a very nice black box. What would you like me to do with it? So we are trying to help support people in the best way that we can. Again, realizing still can't boil the ocean, still can't fix everything, but we can support as much as we can in as many different ways as we can in order to be there in whatever way we can be. I have noticed that there are a couple of comments in the chat, ones that about people not communicating, one that poor Cornwall isn't up there yet. It is gone to board today, I believe. And so we are very, very hopeful that it will be up in the next couple of days. But I have an amazing human who lives down in the southwest, who is based just outside of Totnes, who would love to come and see you, to hear your challenges, to listen to your story, to engage with you and do whatever she can to help support on that Cornwall piece. So also, who doesn't want to go to Cornwall? I'm a paddleboarder, so I'm well up for that in the summer. If you're ever in for a visit in the summer or even in winter, I don't mind. I'm definitely up for a trip down to Cornwall.
I definitely feel like as an East of England representative, I now have to pitch for everyone to go to the East of England, because there are some beautiful coastlines in the East.
I've been there. I was there last week.
Just looking at the comments, we have got a couple more. I'll bring them in. Civil Service is ready to go with an approved system, but local systems are not forthcoming with how to apply. Should care providers delay, or can they claim funding retrospectively?
Oh, this is the difficult question for the day. Funding can be claimed retrospectively to a point. And that point in time is the 1st of December, 2021. Any contracts that were signed before then, we are trying to work across and help support, is 2021. We are working collectively with as many areas as we can. There may be some challenges that we'll experience of being able to help support that far back. Most areas are going from the financial year, but we are able to help support from the 1st of April in the majority, but we want to know from those areas that went from the 1st of December as well if we needed to. But hopefully most areas across the ICSs are looking collectively at the 1st of April.
And with providers that are, say, using one system and they want to take out a new contract with a different system, maybe on your Assured, can they claim funding for that if they've never claimed before? Or...
No, unfortunately, as it stands at the moment, if you already have a digital system, we are not able to help support you to move to a different one. I'm not saying that might potentially change in the future, but as it stands at the moment, we are specifically looking at those areas that don't have a digital record.
However, they could apply for sensor-based force technology. So even if they've got a digital social care record, they're on their digital journey. So they could say, okay, so we're ready to take the next step now. What technology could we add in that's really going to support our residents? So if your integrated care system is also supporting our program by way of adopting sensor-based falls technology or by piloting other care technology, just because you've got a DSCR doesn't mean you can't apply for that. So we're trying to find a way to make sure that every care provider has a way of getting involved if they want to. And if that's not this year, then it might be next year. So please don't panic if your ICS haven't published their application form yet. They're all on with it, but even if they've not got it out yet, it is coming.
Thank you very much. And that moves us nicely on to the next question from Michael. So most of the digitized program from ICBs is focused on digital care records, which are on an approved list, which we've spoken about. How can a supplier of other tech, including falls detection, engage with ICBs effectively to be considered as there is no assured supplier list for this element?
Yeah. And I'm going to be on the edge of honest on this one. We have been working really hard on creation of that assured list for our digital social care record products. We are working towards a framework of compliance for other technologies. So where we are starting to understand the functional requirements of a product set, we're going to be building out those approaches so that people can kind of reference where they are looking at other types of care technologies. We have had a lot of focus this year on the digital social care record side of things. We have our assured list. It's functional, it's programmable. We can do what we need with it. For the other tech, watch this space. We have got plans and approaches that will be coming over the next 3 to 6 months. We will be working with products and providers in order to be able to build out that framework. And within that framework, it'll have functional requirements that we would expect from a product, so that it's kind of like I'm looking for a thing, but I'm looking for a thing that I can make telephone calls on, that can receive a message electronically. I'm not going to tell you if you're going to buy an iPhone or you're going to buy an Android or you're going to buy a Samsung, but I'm going to tell you that you need to buy a mobile phone and kind of direct you down that journey so that we can be far more product agnostic in the way that we're delivering it and helping to support.
Perfect. Thank you very much. And final question. Is there a model implementation plan dependent on size of organisation? And if so, where can this be found?
It's a really hard question. So we are doing a couple of different approaches with this. So we're working at an ICS level so that we can understand how ICSs are working with small scale providers locally, smaller scale providers locally. We're also working nationally at a market oversight list CQC provider level to see if there's ways that we can learn that way. But most of the products have got some type of implementation plan. It could be a really good resource that we start pulling together so that we have those national pieces, and we've got a really good area that is out there in futures that people can go and have a look at, and we'll certainly take it away as a how do people do things if they're looking to be able to implement over different sizes of organizations. So we'll take that and create something.
I think there were some ICBs as well doing some really great stuff. So I'm going to shout out Norfolk and Waveney because they're in the east of England, which is a superb place to visit on your holidays. So Norfolk and Waveney, the team there are doing a great job of listening to care providers of different sizes and creating some of those wraparound tools and resources. And they are committed to working with every single adult social care provider across Norfolk and Waveney to design a tailored implementation plan for that digital journey. So how do you go from paper-based to full-blown adopting care tech on top of a digital social care record? And how can we put you together a plan to get you from A to Z? So there are some really good examples out there, and we're working with the integrated care systems so that once one ICS has developed that, it's shared with the other 41. So we're not trying to recreate the wheel, we're sharing the best of what's happening across the whole country. But as Emma said, each of the assured suppliers will have a version of an implementation plan. So it's not a case of you buy a product off a shelf, off you go. You have to do it all on your own. You know, we've picked these assured suppliers because they will hold your hand and help you through that journey. So they won't by any means kind of take your money and you know, and wash their hands of you. They are there to make sure that that implementation goes smoothly.
My head's like just absorbing all of this, and I've probably got about 1,000 more questions that I could possibly ask you. I am conscious of the time, so I'll probably just going to ask. You know, big up to Norfolk, fantastic. Are there any other ICSs, ICBs, ICPs out there that are doing really incredible things that you would like to shout about so people can go, actually, I'm in that area, so I want to go find out more and engage?
Oh, that's a really tough one. So let's pick a few across the country. Bristol, North Somerset, South Gloucester. They are doing some amazing things with integration with their shared care, and they're supporting people to be able to access information. We have got a Sussex. I can't live here and not shout out Sussex, so I'm obviously going to say they've done some really strong work of how to be able to help support different people. I'm going to have to go with the Black Country. They've also got some great work and some really, really exciting approaches across how they're going to be able to work through in some of their independent living pieces. And then South Cumbria, they're another one that are doing some really, really strong and have been working with the program since its inception. And so they would be my other than obviously where Mark works, because anywhere that Mark's working in the east of England is obviously also doing great things.
And I just want to come in and say you missed off the Lancashire from South Cumbria. Lancashire. I'm a Lancashire lad.
I managed to pull ICSs out of thin air of where do I think, and that's not to say that they're not all my favourite children and they're all doing amazing work, and I don't support any more than the other because otherwise they might get jealous. But to be honest with you, Adam, everybody is doing amazing. Like, we've come at this from stop. And now we've got every single ICS in the entire country recognizing the value of social care, wanting to be able to help support people to put in a digital solution, realizing that as part of their digital journey, they can't do it without all of the people that have the foundations that are doing work together. And I think it's one of the things that is the reason I get out of bed every day. I've got an amazing team that are out there communicating with those 42 different areas, and they're doing amazing work. Some are quicker than others, but I'm okay with that because I want them to get to the point where they're doing the best for the humans that live within their area. And that is the only thing that we should be supporting.
Absolutely, well said. And I was just going to say, I think for experience, definitely kind of havering ICS is actually there's a lack of awareness of social care and what it is. And I know, Caroline, when you and I met with somebody the other day, it was all about care homes and actually just opening their eyes to actually there's so much more to social care than just an elderly care home. And actually there might be a piece there that as a provider you need to do about actually raising awareness of actually that there's learning disability services, there's shared lives, there's, you know, supported living services. So actually don't be afraid to kind of go back and kind of push back and help educate them as well. So Adam, you're going to come in, I believe.
I was just going to come in and go, what a great show. And aren't we super lucky that I'm hoping that you've both agreed to come back next year to talk about digital social care and transformation. I think there's a lot of questions still to be had about that. I mean, I suppose we could probably touch on the ICSs and see what's different by the time you're back next year. But digital transformation in social care has got such a huge appetite at the moment. And I'm one of these people who will always advocate to providers that if you're struggling to find the technology from, I don't know, your ICB, your local authority, have a look what's already on the market, with your Alexas and your Google Homes and your automated lights and motion sensor technology, because not everything has to cost hundreds and hundreds of pounds. There's some tech out there that you can utilize and hodgepodge together at the moment to get you into that position.
Oh, and without a shadow of a doubt, there's so much tech out there that can help support you. I mean, personally, I get really sketched out by an Alexa that knows how big my rooms are, but actually, they're really amazing at being able to turn on lights, support you with different things, remind you on medication, give you that ability to communicate with people that live at home. Just because I don't want it to know that I live in a Hobbit house doesn't mean that I'm the only one out there. And actually, they have just done some amazing works on their smart properties in France. So, yes.
Yeah, I've just shared that link in the thing. They've just kind of done their press release around the senior living in UK, France, Germany, and Italy, kind of what the future will look like from them. So it'll be very interesting. And I think it's good that we've had kind of UK companies involved. So Majestic Care has been involved in that with Amazon. So it's not just Amazon kind of rolling that out. It's good to see that, a bit like, with you guys, that actually social care is really embedded in some of these decision-making things. So, which is obviously vital otherwise. And I think when we talk about tech and we spoke about, medication reminders, is the new iPhone update. I don't know about Android, I can't speak for them, but there's medication tools on there now. There's going to be a big push from Apple about actually the elder market. So actually it's really good. And we need to keep an eye on that as well. So
their watches have impact sensors in them.
Yep.
If you fall over with it, I mean, I am an Android guy. I'm a Samsung person. I will admit this, but the Apple Watch does amaze me for everything that it does do. And with everything in place, your health sensors, your monitors. My granddad can't get his head around it. You can get a Casio Adam on for like £10 and put that on your wrist. Yeah, I get that, granddad. But I want you to have one of these because actually it's going to remind you when you need to do stuff. It's going to tell you when your heart rate's elevated. And if you fall, which you're going to fall because you're really wobbly at the moment, it's going to go boom. And if you don't answer, it's going to call someone to come and sort something out.
And
I think
it is amazing. I think of my nan, and my nan would never, ever wear her pendant because it didn't go with the outfit that she was wearing because it was horrific and white and red. And why would I wear something that looks like that? But if I'd given her an Apple Watch, she would have loved it. And we've got other nans in the team that now have the confidence to go out because they know they've got something on their wrist. So even if they fall and their bag goes wherever the bag goes when they've had a stumble, they've still got something that's going to be able to get them help. The tech is out there. It's just about being able to ensure we know how to be able to get at it, how to support it, and that it is doing tech for good as opposed for tech for bad. And I'm not going to say that there aren't things out there that aren't necessarily the best approaches for particular people.
Well, honestly, thank you both so much for joining us. I'm really, really looking forward to our next conversation on the Caring View. No doubt you're going to be inundated with people wanting to get in touch as well. We're happy to do some. We're happy to do some signposting. So yes, thank you, Caroline. Thank you, Emma, for joining us. Mark, what are we doing next week?
Next week, yes, it's another takeover show. So next week is neurodiversity and diagnosis in the sector. And I say sector, we've actually got Faye Mel, who has appeared on our show before, doing and hosting the takeover, but she is joined by Amelia Pace, who has also been on the show, but also with Dr. Anna Shree from the NHS as well. So I think it's going to be a really good show, a really educational show. So yeah, make sure you tune in next week for that.
Thank you so much, Mark. So this has been the Caring View. Give us a follow on Facebook, LinkedIn, Twitter. Find us on YouTube and subscribe. And yes, if you are a provider and you are concerned about your PIR and how you go around completing it, if you don't know what your PIR is, slightly worried that you don't know, please do tune into our podcast because everything is there for you. And that's going to run through the rest of December into January. And we're also going to have some specials on the actual YouTube show as well for that. So go over to the website. There'll be loads of information on there, and we'll have free resources as well. So thank you, everyone, for joining us. Until next week, we won't see you next week because it is a takeover show, but we are here with some fab guests and a fab guest host. So we will all see you next week. Take care.
Thank you very much, both of you.